I'm with Dan Hoyle with Pathfinders, and Dan, thank you for allowing me to come here to interview you today. And just wondered if you could tell us a little bit about your organization, how it got started, types of services you offer, things of that nature.
Okay. Well, I'm Dan Hoyle, and I'm the founder of Pathfinders. I've been here 20 years, and this is our 20th year of operation. And we were started back in '89. The state needed a program, another program serving this region, and we met the need and applied for the grant and received it, and got started that way. We had to buy the property here, which we initially bought 4 acres and a white house that's next door, and that was our first residential program. And
this is for substance abuse services.
Substance abuse services,
okay.
Totally. Non-mental health services, just total substance abuse services.
Okay.
And we provided residential treatment, and that was what we provided, and we were all in the house next door. Well, we found out immediately that we didn't have enough room and we needed more office space. So we moved to Gallatin to have our office in Gallatin and have the residential program here. And in that process, we started intensive outpatient, which was a new concept that was something that was needed in the community.
Tell us a little bit about the intensive outpatient.
Okay.
What
Intensive
is
outpatient is they go to groups 4 days a week, 3-hour sessions.
Okay.
And it's a level of care under the ASAM criteria that is a little less than some of the other outpatient levels, because it's not in a hospital.
Okay.
And it's just basically counseling, and it's it's group counseling, and it's a great way we charge for our groups. The state pays us $55 a group and per person.
Okay.
And then some insurances will pay us various amounts up to $190 a group. And
okay.
So it's to our advantage to get more insured patients than state patients, but it doesn't work that way. We usually get more state patients.
Okay.
But,
so some people who might come to just general counseling might come once a week or something along those lines, but this is more frequent contact.
Intensive counseling 4 days a week.
Okay.
And so most of the people have to be either a third shift worker or a second shift worker to come during the daytime, or they can come at night and they can work around it in their schedule. So
they don't live here, they can still...
They live in a 25-mile radius, I believe.
Okay, so they can still live in their own homes and drive after work or whatever. Okay.
And so we had one of these programs in Murfreesboro, and we had one in Madison, Tennessee. And we recently closed the Madison and the Murfreesboro office because the revenue was not supporting the operation of the program, and we were supporting our operation here, but it was costing us about $60,000 to keep those programs open, in addition to what it was costing to keep them open. So we just decided to close those programs.
Okay.
The program in Murfreesboro is closing effective this month, and at the end of this month. But we plan to do an IOP here at our residential program. We had one here before that was just lasted about a half a year, and then it kind of dwindled down. The patient mix did, and because the population around here is less, and plus IOP hadn't been accepted as much by the state, I don't believe. But anyway, we're going to do an IOP here, and we're also doing a DUI school here. That is something we haven't done here before, but we did the DUI school in Murfreesboro and had the IOP there.
Tell us a little bit, Dan, about the difference between an intensive outpatient program and your residential program.
Okay. The residential program is a person who qualifies for it has to be homeless. They don't have a place to stay. They need alcohol and drug treatment in a controlled environment. If they they have to be taken out of their community so they can stay sober or get sober. Most of these people are close to a crack house, or their peer group is such that they'll still be using if they stay in their neighborhood where they need to get away from all that.
Sure.
And we provide that avenue for them in a residential setting. The patients here are generally, we do social setting detox here as part of one of our programs, which is a non-medical detox. And so if somebody has had a drink before they come in or use some light drugs, then we can take them and detox them off of that. But the goal is they usually stay in that level of care for three days at max. And we observe them and take their vitals and watch them. And so if the blood pressure shoots up, we can get that down. And we have a doctor that is on staff that is on call that can come and help if we need medical help.
Okay.
But generally, we don't need medical help. It's very rare that we do, and we just call the ambulance when that happens.
Now, sometimes you hear about 28-day treatment programs. Is that what this is, or is this different?
This is a 21 to 28-day program after detox.
Okay. So
if a person is detoxed for 3 days, then they can stay 25 days here. So it's usually a 21-day program. And basically that is, there's nothing magic about 21 or 28 days. It's just that our curriculum is that long of the information that they have to learn about sobriety. And it varies because people vary in their sobriety. If they have just relapsed and it's a very short relapse period and they've been in AA for several years and they understand the recovery program, the 12-step program that we teach here, they don't have to stay as long. But they are monitored and they work as an outpatient. We put them in outpatient when they're that status, and they have to be involved in a recovery program for an extended period of time. We think that people who just come here for 21, 28 days are just beginning in their recovery. It's not a quick fix, and they have to stay in recovery to stay sober. And so by doing that, they go to AA meetings and they participate in intensive outpatient. There's just a lot of sobriety things they can do that to stay sober. And if people stay in our program, stay enrolled in our programs of some sort, either case management or outpatient, and stay connected to us, plus go to AA meetings, then they usually stay sober. Okay,
so I guess getting them out of their environment is a major step, I guess.
Yes. And a lot of the people that, when they leave here, they'll go to halfway houses. And we have several halfway houses that are licensed by the state that do certain things that are state licensed programs that we send people to.
Okay, and that's what I was going to ask you about. If you have relationships with other agencies in the area, it sounds like a halfway house would be one of those places. Do you coordinate with any other agencies for any other reasons?
We coordinate with hospital for medical problems, and then we coordinate with the outpatient programs. The outpatient programs that are, if somebody lives in a certain area, they don't live in one of the areas that we have an outpatient, we'll hook them up to an outpatient program in their area. And then if someone needs additional structure, then we put them in a halfway house, a state licensed halfway house, and then they usually go to outpatient around that, and then they get a job and they have to work in that very strict, controlled environment.
Now, are people coming into this program voluntarily?
Yes. Okay. They generally are told by the judge that it's either jail or treatment, and so they make a choice.
All right. Okay.
And there are some people that choose to go back to jail.
Is that right?
Which is really strange. And that's usually they don't want to deal with their issues. When that happens. And we, in a group setting, we get down to some real nitty-gritty issues that they don't want to deal with, and so they just go back to jail.
And you hear about people who are initially in treatment that have to work through denial, I guess, is one of those first things. How long does that take? How do you deal with that, or how do you help people get through that denial?
Yeah, it's the group does that. The group dynamics do that. And they address all that. And it's not us telling them that they're in denial and preaching to them. The group is what heals itself, and the group dynamics, and that's so powerful when you have a group setting that is very therapeutic, and people identify with the group and what they're saying, and they change, and that's what how we base our program philosophy. We don't sit around and judge people. We have education sessions. We present the facts. They can take them or leave them.
Mm-hmm.
You know, it's just that's the kind of approach. It's kind of a laid-back approach,
okay,
that we do, and we let the patients have enough room in their recovery to do it themselves.
So in the group, you could have people who are, I guess, at the beginning of the program, and at the midpoint, and at the end. Is that correct?
Right,
Is that
yes.
how you do that?
And they
okay.
all help each other
okay.
through that those processes.
Mm-hmm.
And so it's in some groups are more therapeutic than others too, and so they're more effective than others. But generally, all of our groups, we've been participating in a longitudinal study with the state since we've been open, and our current success rate is running about 75%.
Is that right?
Which is really.
What do you attribute that to, Dan?
It's, I think that it's a controlled environment, and when people leave, they're evaluated 6 months after they leave here.
All right.
And so it's not evaluated here in a controlled environment. They're evaluated after they've left here in their home community or gone back to work or wherever. And I think that we just have a dynamic program, and it's the level of care that we're treating is such that, you know, these people can get sober. They are not so sick with psychiatric problems that they can't ever do anything or can't ever make a decision to do anything. They can get jobs. They can become productive people again. And we encourage that, and we try to get people to do that.
Now, do you have people who have psychological disorders in addition to their drug and alcohol
We have
issues?
that.
Okay.
We have some psychological disorders that if we can't counsel them through that, then we send them to a psychiatrist or to a mental health center afterwards.
All right.
To deal with that part of their problems.
Okay.
And like if some people have bipolar problems, then they need to be under a doctor's care because of their medication.
Sure.
And so we encourage that and encourage them to stay on their medication. And see, a lot of people in 12-step programs, since it's a drug-free philosophy, they're told to get off all medications, you know, which is disastrous for some people. So we try to get them to be responsible about their medications. If they need a medication to take to stay sober and to change their life, then they need to take it. And they don't need to play around with that. They need to do what the doctor says.
Now, there are alternatives to 12-step programs. What made you decide to go the 12-step route?
Yeah, there are alternatives to the 12-step route, but we decided that the 12-step program was the most successful approach and the most common approach that was available, and that people can transition into the self-help community a lot easier when they leave us. And the self-help community is the thing that the 12-step program has that no one else seems to have. And I think that you know, a lot of people criticize that, but I think that it does work, and nobody can argue with that point.
Right. So when they leave your program, they are set up with a sponsor, is that correct, in their home communities?
Yes, we generally do that. We try to introduce, we have in-house AA meetings here, and we have outside AA meetings. So we generally try to introduce them to a sponsor in their home communities. If they're too far away, then we try to we find out where the AA groups are and try to arrange them to go there to that meeting and alert somebody that's with the AA organization that this person is coming out of treatment. And that, of course, we have to get a release from the patient to do that, but there's a lot involved in communicating with the public, but we, because of confidentiality, but generally people aren't as afraid of going to AA or self-help communities when they leave this program because they've been exposed to it.
Sure.
And a lot of it is just fear of the unknown.
Susan, Park 1.
They don't participate.
Susan, Park 1, please.
Now, is this a program designed primarily for adults? Do you ever have adolescents?
This is predominantly for adults, but we have thought about doing adolescents.
All right.
In fact, we have thought about building an adolescent program if we can get the funding to do that. And out here on these grounds, we have 16 acres, so we have a lot of room.
Wow.
And it would be the community really needs one.
Yeah.
And the problem with adolescent treatment is it's very sporadic. It's and very cyclical. When schools ends, summer begins, and a lot of them aren't coming to you unless they're court ordered. If during the school system will send them to you, and a lot of times they have to go to get their grades in school.
Sure.
And they have to go to school while they're here too, so that's another issue.
Okay.
And so there's a lot of dead time with adolescent treatment,
right,
as far as no beds, no referrals, and then all of a sudden you have this influx of people.
Sure.
And so dealing with that would be, we need to have the financial help to do that.
Sure.
And so the funding to do that would be a great way to go.
Just a couple more questions, Dan. What do you think are some of the biggest challenges about doing this kind of work?
I think the biggest challenge of doing this work is you see results immediately when people get sober and they change their life, and they really want to change. And when they come to us, they're kind of at the end of their rope. And generally, people really want to make a change in their life. They're ready to be told how to do that or shown how to do that. And so the group dynamics shows them how to do that. The AA program or 12-step program also is a prescription for that. And she tells them what they need to do all that. And that's a real positive thing that that seems to work for people in their lives. And we have answers for people, and it doesn't matter. A lot of the things that people wrestle with, they wonder why they're the way they are. It doesn't matter why they're the way they are. They just have to accept who they are and go forward. And that's what we teach here, basically.
And what is, if I were to work here, what would be some of the difficult things for me, or what might I experience as a counselor that might be difficult for me in my role in doing this kind of work?
Okay, I think the most difficult thing is to lay back and let treatment happen. Okay. You try to force treatment sometimes as a counselor, knowing what these people need and what they need to be told, or what you let them experience that, and allowing them to experience what they need to do to stay clean and sober.
Trust the process.
Trust the process,
yeah.
Right, is the main battle, I think.
Susan,
and a lot of people try to fix.
Part one, please.
A lot of counselors will try to fix everybody, and you can't do that. You have to. You kind of have to work a recovery program for yourself, because you have to let go and let God and just accept that.
Sure.
And you can't force feed treatment on people, and they have to be ready to do it when they do it.
Sure.
And but you can show them the way to do it, and then they can always come back to you, and they do. They'll come back to you for more advice.
Sure.
And you develop a great relationship with the patient that way.
Now, what would you recommend for students who are interested in going into the substance abuse field? What kind of volunteer experiences or anything, educational experiences, anything that you could recommend to them?
Well, I think that, it's for people to become effective in this field, you really have to have some counseling skills and have not be afraid of group dynamics, and understand the group process, and because those principles apply to any setting. It's just a lot easier in this setting because it just works better in this type of setting. But I would tell people to get those skills down and understand the group process, and then learn about yourself and what your needs are. A lot of people have alcoholism in their families, and so they're looking for answers. Yeah. Because it's such an unbelievable situation that people are confronted with, and they realize that, hey, everybody goes through this, and they really identify with it. And there's nowhere else to get that information but in a treatment center.
Exactly.
And so a lot of people heal their own stuff while they're in treatment, and or while they're working in treatment, and but they have to come clean with that and deal with that. And a lot of people need to go to treatment. And I guess that, and
it kind of segues into my last question, is because you hear some people who say, well, you can't really do this kind of work as a counselor unless you've had a substance abuse problem yourself. Do you find that that's true, or
okay? Yeah, I don't have. have a substance use problem.
Okay.
I've been close, but I don't really have a problem.
Okay.
I have had family members that had problems, and in fact they died from their substance abuse. My mother died from her alcoholism, and that's real. To go through that process with a loved one like a mother is really something to go through,
sure.
and you feel so helpless, and it's a great emotional thing that happens to people, and they look for answers, and they remember, and they have triggers that they remember these things that they experience, and it's like a repeat thing, and it's but you learn to get over that, and you learn to forgive your loved one for what happened to them, that they were in fact sick, and you have to accept that, and there's a lot of it is acceptance of the family member that got you interested in this field, and accepting that situation, and realizing that they aren't bad people, they're just sick people, and then transposing that to the patients, realizing that they aren't bad people, they're just very sick people, and they really are. Yeah. It's amazing how that they just totally change when they've been here 28 days. You just see a light turns on in them, and you just see a different person.
Neat to see that.
What comes in and what goes out. Yeah. And it's just so rewarding to see that. Sure. And it's back to the people getting the training they need. They just have to experience. They can take some courses and do some things. Go to visit some 12-step meetings, do some things in the community, volunteer with agencies, do a practicum at an agency. Sure. That type of thing puts people ahead of what they need to learn, and then they really need to know that they are just learning and they don't know anything yet. Right. And it's amazing how I've been in this field for 30 years. And I'm still learning. Sure, exactly. And you never stop learning in this field. I know. And everybody's always different. You know, it's just a different dynamic, and that's what makes it so interesting to me, is that you have such interesting people. Sure. That you deal with. Exactly. Well, Dan, thanks so much for spending time with us today. And it sounds like you have a lot of exciting things happening here, and we really do. And it's just it's great to be a part of that. Well, great. And I'm real proud of it, and I just hope we can continue to get through this recession, because it's real scary. Oh yeah. But we've made some changes in the way we do things to save money, and it doesn't look like it with this new building, but we were building this building in the midst of all this when it happened. Wow. And so that was real scary. We had to stop the construction to just build the first phase. Yeah. And so, but we're okay, and we're managing to get through it all, and I think we will get through it all. Well, Dan, thanks again, and good luck in your future facility. Thank you.